Hi guys, welcome back to my channel. It's Dr. Shaw. I'm a rural family medicine resident, and on this channel I make videos on medical education and just generally being a resident physician and what that really is or feels like. So in today's video, we're just going to be tackling hypertensive emergencies. And the thing is that I want to make sure just before we begin that this is not medical advice. All right, this is strictly medical education. I want to make sure that if you have any questions or if you feel like you're experiencing any of the symptoms, please go see your doctor. This is not medical advice at all. Medical education. All right. Medical education, that's it. In the previous videos, we talked about hypertension and what risk factors lead to having high blood pressure and the correct way to measure your blood pressure at home. So now let's talk about emergency situations. And this is very important for you guys to know, all right? So what is a high blood pressure emergency? It's when you have a serious and potentially life-threatening condition that occurs when a patient's blood pressure gets really high over time. And then when the person's blood pressure gets really, really high, it can lead to an organ damage. So what does that mean? An organ damage means that you can have problems in one or more of the following things. Eyes. So your blood pressure is really, really high. You can have some problems with your eyes, meaning that you can have bleeding at the back of your eyes. You can have swelling of the nerves at the back of your eyes that runs to the brain. All right. So that's one thing that can occur with the eyes. The other thing is that you can have problems with the brain. So when you have problems with the brain as it pertains to having high blood pressure, you can have perhaps bleeding in the brain or a stroke even. So what is a stroke? A stroke is basically when a part of the brain is damaged because there's been problem with the blood flow. All right. So that's something that can happen if the blood pressure is way too high. Another thing, kidneys. Having very high blood pressure can cause damage to the kidneys. It can cause kidney failure. And kidney failure is essentially when the kidneys just stop working. So those are things that can happen with the kidney when you have really high blood pressure. The heart. I think this is the one that most people are aware of. If you have really high blood pressure, it can cause heart problems. So that could be heart failure, it could be heart attack, it can be damage to a major blood vessel. These are things that can happen when your blood pressure is so high that it becomes a life-threatening emergency. Now, what are these numbers? So we talked a little bit about your blood pressure numbers. You have the systolic and the diastolic. When you are in an emergency, the blood pressure levels tend to be 180 over 120. These constitute an emergency situation. In some cases, you can have blood pressure that's much, much higher than your normal, but if you don't have damage to any of the organs that we discussed, this would be called an hypertensive urgency, which means that it is an urgent situation, but you don't have any end organ damage. And this is treated very differently, the high blood pressure emergency. So just so you know that even though you may have numbers that are extremely high, while it is an urgent situation, it's not the same as having end organ damage plus those really high numbers. You know, we talked about how having high blood pressure doesn't really have any symptoms, but having high blood pressure emergency does tend to have some symptoms. Okay. And these are kind of non-specific, but these are some symptoms that you want to be cognizant of, especially if your blood pressure is very, very high. All right. And these symptoms really depend on the organ that's damaged or has been damaged. So that can include things like blurry vision. It can include some sort of vision changes, some headaches, some nausea, vomiting, maybe some confusion can occur. Could be pass out or potentially even have seizures, some weakness or numbness on one side or of the body, one side of the arm, one side of the leg. So those are some things that can happen. Maybe there's some difficulty with talking, perhaps some chest pain, some pain at the upper back or between the shoulder blades. You may also have noticed that your urine has become more brown or bloody. So these are some things that can present with having a high blood pressure emergency situation. So having said all that, I think it's important to know when you need to see the doctor or the nurse. So if you have any of the symptoms that I just talked about, you need to make a phone call, 911 or clinic. You need to call your healthcare professional right away if you are having any of those symptoms and your blood pressure is very high. If you've been checking your blood pressure and you've had these really high readings more than twice, you need to call your doctor right away. Even if your readings are 180/120 and you don't have any of the other symptoms, but the numbers are that high, you still need to call, because this is still a very serious situation. Even if you're not having those same symptoms, just want to be aware that even if you're not having symptoms, this kind of blood pressure is a serious situation. So when you start having these symptoms, what's going to happen? So the thing is that your nurse or your doctor, they're going to ask you more information about your symptoms, like when did they start, what's going on, check your exam. They're going to do an exam and check your pressures. And they might even, depending on which facility you're at, maybe look at the back of your eyes to see if there's any increased pressure in your eyes. So some tests may include things like perhaps like a blood test, a urine test, a chest x-ray, maybe. You may need a CT scan, and a CT scan basically just takes pictures inside of your body. Another thing that you may have to do is called an EKG or an ECG. And basically what that does is look at the electrical activity inside your heart just to see how that's going. So now, let's say you do have this emergency situation. What do you do about it? Well, the thing is that it really depends on your situation. You need to go to the emergency department or to your clinic. Based on the results, based on your readings and your results, it's going to really vary. So a lot of times, if you have these really high blood pressures, you may have to get an IV placed. An IV is a small tube that goes into your vein. And put a picture right here. Based on the results of those lab reports and imaging tests and your readings, you may have to get an IV placed. So they'll put a small tube into your vein, and that's how they give medicines to you to help bring that pressure down. After that, you may get recommended certain things like taking medicine, following the low salt diet, losing weight if you're overweight, and just getting regular exercise. So this is a brief little overview on high blood pressure emergencies and urgencies. Hope that was helpful. Keep that in mind and stay safe now.